You open your eyes, and before you even move, you feel it. Your mouth is bone dry. Your tongue feels like it is glued to the roof of your mouth. Your lips are cracked and rough. You reach over to your nightstand, grab that glass of water, and take a long drink just so you can swallow. And then you get up, brush your teeth, and move on with your day without giving it another thought. Maybe this has been happening to you every single morning for months, maybe for years. Maybe you have mentioned it to your doctor, and they told you it is just what happens when you get older. Maybe you have simply accepted it as one of those annoying things that come with aging, and there is nothing you can do about it. But I need you to hear me very clearly right now. Waking up with a dry mouth every single morning after the age of 60 is not normal. It is not just an inconvenience, and it is absolutely not something you should brush off or ignore. Your body is trying to tell you something specific and something important during those hours you are asleep. And in today's video, I am going to explain exactly what that message is and why ignoring it could be putting your health and, in some cases, your life at real risk. I am Dr. Charles Anderson, and I have spent years helping seniors understand the health signals their bodies send them every single day. Signals that are too often dismissed, overlooked, or chalked up to aging when they are actually pointing to something that can be identified and addressed. If this is your first time here, this channel is dedicated to bringing you clear, honest, evidence-based health information specifically for adults over 60. I would encourage you to subscribe right now and turn on notifications so you never miss what we cover, because the topics we discuss here are the kind of things that can genuinely change your health trajectory. Now let us get into what your dry mouth has been trying to tell you, because once you understand this, you will never look at that glass of water on your nightstand the same way again. Before we talk about the causes, I want you to understand just how important saliva actually is, because most people drastically underestimate what it does. Your body produces between 1 and 1.5 liters of saliva every single day. That is roughly the same volume as a large bottle of water, and every drop of it is working to protect you. Saliva is not just moisture in your mouth. It is one of the most sophisticated protective fluids your entire body produces. It contains enzymes that begin breaking down your food before it even reaches your stomach. It contains antimicrobial proteins that actively fight off harmful bacteria and viruses. It neutralizes acids that would otherwise eat through your tooth enamel. It keeps the soft tissues of your mouth, your gums, your cheeks, your tongue lubricated and healthy. And here is something that very few people know. Saliva production is directly controlled by your autonomic nervous system, the same system that regulates your heart rate, your blood pressure, and your digestion. So when your saliva production drops significantly, especially during sleep when your body is doing its most important repair and maintenance work, that is not a random glitch. That is your body raising a red flag about something deeper. A major study published in the journal Gerontology found that chronic dry mouth affects up to 46% of adults over the age of 70, making it one of the single most common health complaints in seniors. But here is the finding that truly stopped me in my tracks when I first reviewed the data. In the vast majority of those cases, the dry mouth was a symptom of an underlying condition, not a standalone problem. It was a signal, not the disease itself. So the real question is not, why is my mouth dry? The real question is, what is my body trying to warn me about? And I am going to walk you through 6 specific answers to that question right now. Please stay with me all the way through, because the last thing I'm going to share with you is something that most doctors never bring up during routine visits, and you absolutely need to hear it. The first warning your morning dry mouth could be sending you is about your blood sugar, and this one is critically important because of how quietly and gradually it develops. One of the earliest and most consistent signs of either undiagnosed type 2 diabetes or a condition called prediabetes is persistent dry mouth, particularly in the morning. Here is why. When your blood sugar levels are elevated, even moderately elevated, in a range that might not trigger obvious symptoms, your kidneys go into overdrive trying to flush out that excess glucose through your urine. That process pulls a tremendous amount of fluid out of your body, especially overnight when you are not replacing it by drinking anything. Your mouth and throat are among the very first tissues in your body to feel that fluid loss because the mucous membranes there are extremely sensitive to even small changes in hydration levels. They signal distress quickly and unmistakably. A study from the National Institutes of Health found that 83% of people with poorly controlled type 2 diabetes reported frequent dry mouth as an ongoing symptom. But here is the number that should make every senior watching this stop and think very carefully. Approximately 1 in 3 adults who currently have type 2 diabetes in the United States do not know they have it. They are walking around with elevated blood sugar. Their kidneys are working overtime. Their body is slowly dehydrating from the inside out. And the most obvious clue their body is giving them, that dry sandpaper mouth every single morning, is being ignored or dismissed as just part of getting older. And dry mouth from blood sugar problems almost never comes alone. You might also notice that you feel thirstier than usual during the day, not just when you first wake up. You might be getting up to use the bathroom more frequently at night. You might have noticed an unexplained fatigue that just will not lift no matter how much rest you get. You might have some tingling or numbness in your feet. Or your vision might have seemed a little blurry at times. You do not need to have all of these symptoms. Even just 2 or 3 of them, alongside your persistent morning dry mouth, is more than enough reason to talk to your doctor and ask specifically for a fasting glucose test and an HbA1c test, which measures your blood sugar averages over the past 3 months. This simple test takes less than 5 minutes, and it could catch a developing problem that your dry mouth has been quietly trying to warn you about for months or even years. Please do not wait on this one. The second warning is about your medications, and this is one of the most common culprits in people over 60. Yet it is the one that gets overlooked more than almost any other. Here is a number that shocks nearly everyone I share it with. Over 500 prescription and over-the-counter medications list dry mouth as a known side effect. 500! And the older we get, the more medications most of us are managing at the same time. There is a concept in medicine called polypharmacy, which simply means taking multiple medications simultaneously. It is incredibly common in adults over 60. The average American over 65 takes between 4 and 5 prescription medications every single day, plus multiple supplements on top of that. And a comprehensive review published in the Journal of the American Geriatric Society found that seniors taking 3 or more medications simultaneously had a 63% higher likelihood of experiencing chronic dry mouth compared to those on fewer drugs. Some of the biggest offenders include antihistamines, antidepressants, particularly the older tricyclic types, blood pressure medications, especially diuretics and certain beta blockers, bladder control medications, anti-anxiety drugs, certain heart rhythm medications, and even common over-the-counter sleep aids. And when you combine 2 or more of these medications, the drying effect becomes dramatically amplified. Each drug on its own might cause mild dryness, but together they create a cumulative effect that leaves your mouth parched. Now, I want to be absolutely clear. I am not telling you to stop taking any medication. What I am telling you is that if you are waking up every morning with that desert dry mouth and you are on 1 or more of these drugs, you need to have a specific conversation with your doctor or pharmacist. Ask them directly, could any combination of my medications be causing my dry mouth? Ask about dose adjustments, alternative formulations, and timing changes, because sometimes simply shifting when you take a medication can make a real difference. This is a solvable problem, but only if you speak up. But the real danger begins with the third warning, and I need you to pay very close attention to this one because it affects an enormous number of older adults, and the vast majority of them have absolutely no idea. I am talking about obstructive sleep apnea. Sleep apnea is a condition where your airway partially or fully collapses while you are asleep, causing your breathing to stop and start repeatedly throughout the night. In many cases, this forces your body to switch from nasal breathing to mouth breathing as a survival mechanism to get air in however it can. Nasal breathing naturally maintains moisture throughout your mouth and throat. Mouth breathing does the exact opposite. It evaporates saliva rapidly, which is precisely why you wake up with that intense, uncomfortable desert-like dryness that no amount of water the night before seems to prevent. But here is why this matters far beyond just having a dry mouth. The sleep apnea itself carries devastating consequences for seniors that many people are completely unaware of. Research published in the Journal of Clinical Sleep Medicine showed that untreated sleep apnea in adults over 60 increases the risk of stroke by 60% and the risk of significant heart disease by 40%. It dramatically worsens high blood pressure. It accelerates cognitive decline. It increases the risk of developing type 2 diabetes. And it does all of this silently, night after night, while you are asleep and completely unaware of what is happening. The vast majority of people who have sleep apnea do not know they have it. They may not even snore loudly, or if they do, their family has heard it so many times that everyone just assumes it is normal. If you snore regularly, if your partner has ever noticed that you seem to stop breathing briefly during the night, if you consistently wake up feeling exhausted despite sleeping what should have been a full night, if you wake up with morning headaches, or if you feel foggy and unfocused in the early hours of the day, your dry mouth may actually be the least concerning symptom you should be paying attention to. Let me tell you about a patient I will call Robert. Robert was a 72-year-old retired postal worker who came to see me primarily because of his dry mouth. He had been dealing with it for about 4 years. He kept a water bottle on his nightstand, he had tried every dry mouth spray and rinse available, and his dentist had flagged a sudden increase in tooth decay that seemed to appear out of nowhere. His wife had been telling him for years that his snoring was getting worse, and that sometimes he would go completely silent for several seconds before gasping and starting to breathe again. But Robert always waved her off. When we finally connected the dots between his dry mouth, his persistent fatigue, his gradually worsening blood pressure readings, and his wife's observations about his nighttime breathing, we ordered a home sleep study. The results revealed moderate to severe obstructive sleep apnea. Robert was stopping breathing an average of 28 times per hour during sleep. After starting CPAP therapy with a heated humidifier attachment, his morning dry mouth was essentially gone within a month. But what was even more remarkable was that his blood pressure, which had been quietly creeping upward for 3 years despite increasing his medication dosages, actually improved to the point where his cardiologist was able to reduce one of his blood pressure drugs. His energy came back. His wife said he seemed like a different person. That dry mouth had been the visible tip of an invisible iceberg that was silently damaging his cardiovascular system every single night for years. The fourth warning involves something that sounds simple but works very differently in seniors than it does in younger adults. I am talking about chronic dehydration. As we age, something happens that most people are completely unaware of. The sensation of thirst becomes significantly dulled. Your body can be operating at a meaningful fluid deficit, genuinely needing water, and it simply does not send you the warning signal it used to. Research published in the European Journal of Nutrition confirmed that adults over 65 are chronically underhydrated compared to younger adults, often with absolutely no sensation of thirst whatsoever. Your kidneys also become less efficient at conserving water as you get older, which means you lose more fluid than a younger person would under the exact same circumstances. You can be dehydrated without feeling thirsty, and that morning dry mouth may be the clearest signal your body is able to give you. But there is a deeper concern here that most people never consider. Even mild chronic dehydration directly thickens your blood. When your blood is thicker, your heart has to pump harder to move it through your body, putting unnecessary strain on your cardiovascular system and worsening conditions like hypertension and arrhythmias. So your morning dry mouth may be telling you that your body is in a state of ongoing dehydration that is quietly stressing your heart every single day. For seniors already managing blood pressure or heart conditions, this is something to act on, not ignore. The fifth warning is about hormonal changes, and it affects both women and men over 60, though in different ways. For women, the decline in estrogen levels that occurs during menopause and continues into postmenopause has a direct and well-documented impact on saliva production. Estrogen plays a crucial role in maintaining the moisture of mucous membranes throughout the body, and that very much includes the mouth. As estrogen levels drop, the salivary glands become less efficient, the mucous membranes thin, and dry mouth becomes increasingly common. If you are a woman over 60 experiencing not just dry mouth, but also persistently dry eyes, dry skin, or vaginal dryness, all of these symptoms are very likely connected through the same hormonal pathway. There are both hormonal and non-hormonal approaches that can significantly improve these symptoms, and your doctor or gynecologist can help you determine what is most appropriate for your individual health situation. For the men watching, hormonal changes affect you as well, though the mechanism is somewhat different. Declining testosterone levels can influence fluid regulation and glandular function over time. But what affects men over 60 even more significantly when it comes to dry mouth is the medications used to manage prostate health. Medications for benign prostatic hyperplasia, commonly known as an enlarged prostate, are incredibly common in men over 60. Many of these drugs have significant anticholinergic properties, which is a medical way of saying they reduce the activity of the glands that produce saliva and other bodily fluids. If you are a man on prostate medications and you have noticed that your dry mouth has gotten worse since starting those drugs, this connection is important to discuss with your urologist. There may be alternative medications or dosing strategies that can manage your prostate symptoms while reducing the impact on your salivary function. The sixth warning is one that is critically underdiagnosed, and I want every person watching this to know about it. It is an autoimmune condition called Sjogren syndrome. In this condition, your immune system mistakenly attacks the glands that produce moisture throughout your body, including the salivary glands and the tear ducts. It disproportionately affects women, with 9 out of 10 diagnosed patients being female, and the average age of diagnosis falls in the late 50s to early 60s. Sjogren syndrome is notoriously underdiagnosed because its primary symptoms, dry mouth and dry eyes, are so easily and so frequently dismissed as just normal aging by both patients and doctors alike. If your dry mouth comes paired with persistently dry, gritty, or burning eyes, unexplained joint pain, unusual fatigue that seems out of proportion to your activity level, or a general sense of feeling unwell that you cannot quite put your finger on, I want you to do something very specific. I want you to mention Sjogren syndrome to your doctor by name. Say those words out loud in the appointment. Ask to be tested for it. A blood test can look for specific antibodies associated with the condition, and getting the correct diagnosis can open the door to treatments that genuinely and measurably improve your quality of life. Do not let this one slip through the cracks, because it is one of the most underdiagnosed conditions in older adults, and the treatment exists if you can get to the right diagnosis. Now, I promised you that I would share something that most doctors do not bring up during routine visits, and I want to deliver on that promise because this information genuinely matters. There is a connection between your oral health and your brain health that is only now beginning to get the serious scientific attention it deserves. When your mouth is chronically dry, the antimicrobial protection that saliva normally provides drops dramatically. Without adequate saliva, harmful bacteria multiply rapidly in the mouth, particularly along the gum line and between the teeth. One specific type of bacteria associated with gum disease, called Porphyromonas gingivalis, has been found in the brains of patients with Alzheimer's disease. Researchers are actively investigating whether chronic oral infections, driven in part by long-term dry mouth and poor saliva function, may contribute to the kind of neuroinflammation that is linked to cognitive decline over time. I want to be careful and responsible with how I present this to you. I am not saying that dry mouth causes Alzheimer's disease. The science is still developing, and there is much more research to be done before any definitive causal link can be established. But what I am saying is that protecting your oral environment by addressing dry mouth is not just about comfort or preventing cavities. It may, based on the direction the current research is heading, be part of protecting your cognitive health as you age. That is a connection that I think is worth taking very seriously. And it is one more reason why your morning dry mouth deserves investigation rather than dismissal. And there is one more piece of this puzzle that ties everything together. Nighttime mouth breathing is often the direct mechanical cause of morning dry mouth, and many doctors dismiss it as harmless. But emerging research suggests otherwise. When you breathe through your nose, your nasal passages produce nitric oxide, a molecule that plays critical roles in blood pressure regulation, immune function, and oxygen delivery. When you breathe through your mouth during sleep, you bypass this entire protective system for 8 hours every single night. Over months and years, this means your blood vessels miss out on vasodilation signals, your immune system loses a key boost, and the air reaching your lungs arrives unfiltered and unhumidified. Now let me give you a clear and practical action plan that you can start using today. Step 1 is the medication review. Write down every single medication and supplement you take, including anything over the counter. Bring that complete list to your next doctor or pharmacist appointment and ask specifically whether any combination of these could be causing or worsening your dry mouth. Ask about dose adjustments, alternative formulations, and timing changes. This single conversation has resolved morning dry mouth for more patients than any other single intervention I have seen in my practice. Step 2 is the blood sugar check. If you have not had a fasting glucose or HbA1c test in the past 12 months, schedule one this week. It takes less than 5 minutes, and it could catch a developing problem that your dry mouth has been trying to signal for months or years. Step 3 is the sleep assessment. For the next 7 nights, keep a small notepad by your bed. Each morning, write down whether your mouth was open or closed when you first woke up, whether you feel genuinely rested or still exhausted, and if you have a bed partner, ask them to listen for loud snoring or pauses in your breathing during the night. If you see a pattern forming, ask your primary care doctor for a sleep study referral. Many insurance plans cover home sleep studies for patients over 60, and the test is done comfortably in your own bedroom. Step 4 is strategic hydration. Begin drinking about 16 ounces of water spread across the 2 hours before bed, not all at once right before you lie down. Increase your total daily water intake to at least 64 ounces spread throughout the day. Set reminders on your phone if you need them, because the thirst signal is simply not as reliable after 60 as it was when you were younger. One important safety note: if you are on blood thinners, ACE inhibitors, or lithium, please discuss any significant changes to your hydration habits with your doctor first, as shifts in fluid intake can affect how those medications behave in your system. Step 5 is overnight symptom relief while you investigate the root cause. Look for a mouth rinse or oral gel containing xylitol, such as Biotine or ACT dry mouth rinse, available at any pharmacy. Use them right before bed. Xylitol helps maintain moisture and provides mild antibacterial protection for your teeth while you sleep. Avoid any mouthwash containing alcohol, which worsens dryness. You can also try adhesive nasal strips to encourage nose breathing. Sleep on your side rather than your back, and use a bedroom humidifier if your home is dry, especially during winter months. Step 6, and this is the one most people skip, but it might be the most important of all. If your dry mouth comes with dry eyes, joint pain, unusual fatigue, or you are a woman over 55, ask your doctor specifically about Sjogren syndrome. Say the name out loud. Ask for the blood test. Do not let this one get brushed aside because it is one of the most underdiagnosed conditions in older adults, and getting the correct diagnosis can genuinely change the direction of your health. One important safety note before I wrap up. If your dry mouth is accompanied by pain inside the mouth, difficulty swallowing, white patches on your tongue, bleeding gums that will not resolve, or unexplained weight loss, see your doctor promptly rather than waiting for a routine appointment. I want to leave you with this thought. Morning dry mouth is common, but common and normal are two very different things. In the vast majority of cases, that dry mouth is pointing at something specific and treatable. Medications, blood sugar, sleep apnea, chronic dehydration, hormonal changes, or an autoimmune condition. All 6 can be addressed. You now know what to look for and what to ask. At 60, 70, 80 years old, you have earned the right to take your symptoms seriously, to advocate for yourself in the doctor's office, and to keep asking questions until you get real answers. Your body has been talking to you every morning. Now you know how to listen. If this video helped you understand something that your doctor has not explained, please subscribe and turn on notifications. Share this with someone you love who wakes up with dry mouth every morning. And leave a comment telling me whether you think your dry mouth is connected to medications, sleep apnea, blood sugar, or something else we discussed. I read every comment, and your responses help shape future topics. I am Dr. Charles Anderson, and I am here to help you take charge of your health. Take good care of yourself, and I will see you in the next video.